Hi, welcome to Fertility Talks. I'm Mary Wong, and tonight I have a special guest who I'm so pleased to have here. Thank you, Amy, for being here with us.
Thank you for having me.
I'm excited because you're really forthcoming and wanting to share your story with all of us who are currently having issues with it. Not myself, obviously, because it's past tense, but just sharing your story, I think, will make a big difference for others going through it. And in your case, how old were you when you started trying?
I had just turned 36.
Okay. And why don't you just go ahead and start sharing your story, and I'll just, go in and ask you some questions if need be.
Okay,
Okay.
sure, sounds good. So I have a wife, so same-sex couple. So when we decided that we wanted to start a family, obviously we needed the clinic. So we both went in at that time, and we had decided she was going to carry the first child, but we asked to both get screened at that point. So just the ultrasound and blood work. And so we had those done and then came back and sat down with the doctor, and the doctor said to my wife, everything looks good. And then he said to you, I just remember him pushing the paper and being like, you not so good. And I was thinking, I had no idea. And I was like, oh, okay. And so it was at that point he said, you have something called polycystic ovarian syndrome. And I was like, it was the first I had heard of it. I had had irregular periods growing up, but I had never heard of PCOS. And at the time, I just kind of left there because I wasn't trying. So it didn't really matter to me. And I just thought, well, I'm not going to accept that label. And I'm sure that, like, I like looking at health from a holistic standpoint. So I just thought, I'm sure there's a way that I can try and get around this. And I didn't feel great about it being presented as a kind of a stumbling block, but it was what it was. So then when it came time
Oh,
for
wait, you're
to,
just cutting out just one sec. You
okay,
just cut out for a second, but that's okay. And you're getting pixelated again. So I don't know what's going on, but let me see. You're moving. Okay.
does it not make a difference?
No, but at least we can hear you. So
Okay.
this is unintentional, everyone. She's not trying to hide her face. There's like mug shots of people right on TV. You're not hiding out, I know.
Yeah.
But just in case it goes in and out,
Okay.
it looks a little better again. But what I want to know is, so how old was your wife when she was trying to conceive?
Um, I believe she was 36. She had just turned 36 too.
Okay, so you're the same age, really. Trying.
Well, we're when we started trying, yeah.
Yes. Okay, got it.
Yeah.
All right.
Um, so anyways, when it came time for me to
This
start
is good now.
trying, okay. Um, then I just kind of went in with it. I really, really, really wanted to conceive through IUI. Our first son was conceived that way, and it was important to us to have the least amount of intervention. And then I just started trying, and didn't work, and didn't work, um, and then I started to try medicated cycles, and as I'm sure everyone knows who has had trouble conceiving, you just kind of get on that train and you get sucked in and you just keep going, and my personality is very, okay, it didn't work, let's try again, let's try again, let's try again, well, let's try this. And I didn't really know at the time that there was anything other than I felt like I was in the best hands. I was at a fertility clinic. I had drugs if I need it. Not that I wanted to take them, but um, and I just kept going, and it obviously gets harder and harder and more stressful, and I think scary too. Thinking, well, wait, what if this doesn't happen? And I wanted it to so badly, and then that wanting makes it even harder. Um, but I think the biggest struggle for me was the fact that I was trying to surrender and not try and not want it as much. But I I physically had to go into the clinic. I had to do the cycle monitoring because I didn't have another option. So
Right.
um,
Yeah. It's not like
I
you can go home and relax and then it'll spontaneously happen. That just won't happen.
no.
No.
Yeah, so there was no like I can't just let go and see what happens because I physically had to go and be in the environment, which I mean, I love the clinic I was at, but it's not a happy environment. It's like
No.
it's stressful and you try and block yourself off. And initially when I started in the clinic, I thought, well, I'm just here because I have to be here. I didn't feel like I had fertility issues until I had fertility issues that I still believed when I went in that even though he said I had PCOS that I was going to be able to conceive. So um, anyway, I tried. I think I tried 8 rounds of IUI, some medicated, some not, and then decided that we were going to give IVF a try. And I didn't really want to, but for me, it was in my back. That was my back pocket, like my plan B. So it was kind of like, hands up. Okay, let's just do it. And so I did the retrieval, and and then waited, and then did the implantation, and then it didn't work. And I was like, wait, this didn't work because I didn't know what the odds were, and I just assumed, okay, like it wasn't our dream, and it's not what the way we envisioned it. But at that point, it was a miracle either way. And so I remember going back into the to see my doctor and him saying, well, it didn't work, so we'll just give it another try. And I was like, no, we won't. Like, that's not good enough. Like, I left that day, and he's like, just come back for cycle monitoring. And I left that day and I was like, that's not good enough. Like, I need answers because I've done IUI 8 times and I just did IVF and it didn't work. So to me, I'm like, something has to change. There has to be something else because I just can't keep going because keeping going on this train isn't working for
Right, right.
me.
What's that expression? It's like going down the same, a mouse going down the same um, path in the maze, thinking that you're going to get to the other
Right,
side. It's just not going to work if you go down the same path, right?
right.
Mhm.
Yeah. So I had a friend that did IVF and she was like, we have to do Chinese medicine. So actually, just before I did my implantation, I found a traditional Chinese medicine doctor to go to and had maybe 1 or 2 treatments before the implantation. And then he said, well, I can't really do much, but it like you need more time. And I was still in the like, well, I don't have more time, and so I said, like, I'll give him a month, I'll take a month off after IVF didn't work, like, let's see what can happen. And then my cycles, it had a little bit of an impact on my cycle. um
Meaning
I
the
still
IVF drugs?
no,
No.
his treatment, so
Oh, got it. Okay.
the
Okay.
acupuncture and some of the herbs. But
Mhm.
I wasn't feeling confident. I was getting more stressed because more time was passing and I wasn't trying and I wasn't seeing great results and I didn't have a connection with him at all, which is fine. But for me, I was at the point where I'm like, I need someone to grab my hand and pull me through this because I'm completely lost and I don't know what to do. Um, and then serendipitously, I don't even know if you know this story, Mary. I'm a physio, so I had a client who had fertility issues for years, and a year before, I don't even maybe I had just started trying, but I didn't think I was having issues. She was telling me about Randine Lewis, this woman who she went to the States, and this lady helped her conceive. She went to these workshops, and and I was like, oh, okay, just thinking in my head, I was like, well, I don't need help, but like she had a great story in that, and so then I think when my IVF failed, she had come back in as a patient, and I said, remember you were telling me about that woman? can I have her name? And her daughter was with her, and she got her daughter
Oh,
to write it down on a piece of paper and like folded it up. And I was like, thank you so much. So I went home and I Googled Randy Lewis, ordered a book right away, and then read the book, and I was like, okay, like I'm on board for this. I'm on board for this. And then I remember my client saying, because I remember her saying like maybe that Randy doesn't treat people one on one. Because I was all prepared. I'm like, I'm going to the States. I'm going to find her. And she said, but there are people that train underneath her. And I was like, okay. So I Googled practitioners trained, and then this list came up, and then your name was on there. And I feel like I created this, but the day I walked into my fertility clinic to start trying, there was a pamphlet that said acupuncture. And in the back of my mind, I'm like, I might need this one day. Picked it up, put it in my bag, and it was for your clinic. And so as soon as I saw your name online, it's like, oh my gosh, that was the pamphlet I picked up like a year ago. So then I called you because I was just not confident with the guy that I was with. Um, and then I came down to see you, and I was like, this, like, if you're not going to help me, then no one else can. Like, I just right away, I bought in, and I'm like, I'm all in for this. Um, and the thing, you know how I was saying I felt like I wanted someone to grab my hand and like take me? Well, I left the appointment. I was like, she's not going to grab my hand. And I'm kind of confused about how I feel about this, but I'm like, no, it's okay, because you were like empowering me. Like I was like, you have to tell me when, and you're like, no, like you were like putting it back, like I'm here to help you, but you like it's your decision when you feel right, like to try again. And I was like, I was just so exhausted at that point. I wanted someone to tell me, and I'm like, okay, I can do this. I can give it a chance. And I mean, I appreciate that you did do that for sure. Um, so yeah, I mean, you know the story, but I started working with you and you're like, "Oh, it's 90 days." So I came to you at the end of November and then saw massive changes right away. Like my next cycle was very, very different, like shortened it, and then the timing just didn't work out because it was going to be around Christmas. I'm like, I just don't want to go into the clinic. So I honestly was probably with you for 6, 7 weeks of treatment. And then I went into the clinic to start trying, and I had 2 vials of sperm left from our donor, the same as our son, and that was super, super, super important to us. And he had been cut off, so that was really we had 2 left, and
right.
so and I wholeheartedly believed that it was going to happen. Um, I felt. And so I went through the process, went in, I was inseminated, and I truly believed that I was pregnant. And then I got my period. And I was devastated because I thought, I don't understand. Like, everything was lined up, and I really believed in it. And I thought, okay, well, again, I was a little bit back on the train, but I had to pull myself way back. And I just decided, you know what? I have one more shot. I'm like I was with you. You're still treating me, and I just because it was the whole battle of surrendering and how much to like when every ultrasound would be like, oh, it's growing this much, and like I knew everything to a T, and I just decided, Amy, don't even look at the ultrasound. Just go in, have them do it, go home like for the monitoring. I don't want to know. They'll call me when I need to come in, and I was able to do that and just do my best to just kind of pull away from it, and it worked. And it was the last try. It was the very last try. And then my wife was actually going to try and conceive for a second child. So it was my very last time.
Literally.
So
Yeah.
yeah,
So,
so
which is shocking, right? Because you've gone through so much and there was so much at stake because it was literally the last
the
vial
last time, yeah,
and the last time.
yeah.
So, wow. You were
So
in shock?
I was in shock, absolutely. And I didn't, I had spotting earlier in the week, and I literally thought like that was it. And then a couple days went past and I didn't actually end up getting my period. So in the back of my head, I was thinking, I didn't talk to my wife about it. I just, because it's so tiring, and I didn't even want to take a pregnancy test, but I decided I was going to work that day. I started at 7 in the morning, and I'm like, okay. I was going to bed that night, and again, it was just in my head. I wasn't even talking about it because between us, I had gotten my period, and that was it. Right? We were just
Right.
moving on. I was like, I'm going to wake up in the morning, take the pregnancy test, so I can just move on. I just like we need to move on, and this is it. And I took the pregnancy test, and I was like obviously, like oh my, like I just started shaking, 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 shaking,
Yeah.
and that yeah, it was crazy.
And that was your only pregnancy, right? You had never been pregnant prior.
No,
No.
no.
So that's a
So
really surreal experience.
yeah,
And so did you believe it to be true when you actually got pregnant?
I did because I always and again, I'm sure I probably created it, but I always thought that I might have trouble conceiving, but I firmly believed as soon as I conceived that I would have no problem maintaining the pregnancy.
And
So,
there you are. You proved
yeah.
that to be true.
Good
Yeah.
and bad.
Good and bad. Well, yeah.
Yeah.
But good because you have a little one now.
Yeah.
So that's awesome.
Yeah.
And I mean, if there's one specific word of advice that you have for people watching, what would that be?
Through the challenges, you mean?
Yeah, absolutely.
Um, no, I think it's obviously tough to say one word, but even to speak to speak for other people because everyone's situation is so different. And I think back. I mean, I could still think back to my journey and my troubles conceiving, and it's still heartbreaking. Like I know I still have all that emotion, just because of how hard it is. But I think about my story and like I remember having like a 1 week old and your book had just come out and I was reading it and I was like, Mary did IVF that many times. Like here I am like devastated because like every day to me was like excruciating and I just think there's so many stories and miraculous journeys that people go through. But I think the biggest thing is just hanging on to that belief. And I
Mm,
have a family member right now too that's kind of just on the cusp of things aren't working out,
mm.
and that's all I could say is you just have to hold out that belief that one day it will happen, and
It keeps
then
you going. Yeah,
and surrender because if not then you can't. It's just it'll beat you up the process.
absolutely. And
So
I love how you say that. And it's kind of like keeping that eye on the ball, but yet surrender.
yeah,
And,
which is the toughest thing.
absolutely.
That's the toughest part.
Like, listen, I had no idea that I would do so many IVFs. And honestly, of course, I didn't even know that I would need anything beyond just naturally in the bedroom, right?
Yeah,
Like, nobody
yeah.
expects to have trouble. Your wife, what was it, her first IUI?
Second, yeah, just
Second.
like
So very quick, right?
yeah,
So, and seeing that and witnessing that in your home, you would expect that to be the true, the same way for you,
yeah,
right? So
absolutely.
you don't expect it any other way. So, I expected full well that I'm like completely healthy, living a healthy lifestyle. But who knew I would have had blocked tubes and
Yeah,
I couldn't even do IUI, right? I had to actually do
yeah,
IVF. So that's what kept me going. It's like, okay, well, it can work.
yeah,
And yeah, you just go through it.
yeah.
I guess what I want to say to people out there is like sometimes you actually don't know how strong you really are, right?
Mm-hmm.
Like
Yeah,
as you go through it, it's heartbreaking for sure when you're
yeah,
down in the dumps, but somehow we persevere.
yeah. And I think the other thing that's important, and I say this in my professional life too, to my patients as a physiotherapist, that I truly believe in anything to do with our health, that there is absolutely someone out there that can help you with what you're going through. You just have to find the right person. And that's why, like, I serendipitously stumbled upon you. And I know, like, I wrote you right after I had my baby. I like, you absolutely are the reason why I was able to conceive. Hands down. Like,
Oh,
there's no question. You know how grateful I am for that gift to me and my family. And
mm.
that's why I send everyone that I know to you,
Thank you.
because it's just, you have to keep searching. And I tell people that there's someone out there that can help you. Maybe not hold your hand like I wanted, but
Didn't I hold
empower
your
you. You did hold my hand. You empowered me, and that's the best thing. And I'm sure everyone that shows up in your office is exhausted because
hand?
they've done the walk. So,
Well, yes, the
yeah.
journey is exhausting for sure.
Yeah.
So I really want to acknowledge you for, being able to persevere and being patient, although being the type A that you are, right? You
Yes.
still went through it and you still surrendered. It's awesome
Yeah.
because some people don't. Some people do give up. I do
Yeah.
see that sometimes.
Yeah. I can
Not so
imagine.
often, but it does happen, right? Not
Yeah.
bad or wrong. It's just, gosh, like, and
Sometimes you
we
have
have
to.
to know, yeah, we have to know
Yeah.
when it's time to stop. It's like,
Yeah.
get off this before you're totally broken.
Yeah. Absolutely.
Right. And I want to say to those people watching, I totally did not invite Amy to, say nice things about me.
You
That was completely unexpected. I just wanted to hear your story because I
No,
thought
but
people,
you, as you know, like, you're a major, major, major part of my story. So it's not provoked. You
okay.
are in my story. So
All right. Thanks. So, meaning for those of you out there who are way far away, I mean, do find someone, a kind of practitioner that will be suitable for your needs, right? So,
yeah.
it doesn't have to be me. If you're close, of course, come and see me. But if
Yeah.
you're not, and actually,
There
you're
is a
not,
Mary out there.
yeah, there is a
No.
degree out there. I mean,
Yeah.
how long was your commute when you came in?
An hour.
Yeah. So,
Yeah.
it's not that close, but it's not
No.
crazy far. I mean, I've had
Yeah.
some people that really do travel far to come see us.
I can imagine.
Yeah. But you know what? People will do anything on this journey,
I
right? It's
know.
just,
You do what you have to do.
yeah. Yeah.
Absolutely.
Sometimes it's a little too extreme.
Yeah.
And but I think as you mentioned, you gotta find it's kind of like your community of people that'll help you,
Yeah.
right?
Yeah.
And I'm very big on that. So you found your
Yeah.
community, and
Yeah.
here you are with the 2-year-old, and you're done.
I am done.
Yes. So it's awesome, and you're glowing.
Yeah.
And I'll tell you guys, when she came in first to see me, she didn't look all happy, smiley like this,
Yeah. No kidding.
right? Very,
Yeah.
very solemn, very much
Tired
more tired. Yes.
and
Yeah.
sad. Yeah.
Absolutely. So we get it. And I mean that's why I think it's important to share stories because know that although you're on the other side of it, know that you were once where they people are now, right?
Yeah.
Just as
Yeah.
I was. Yeah.
Yeah.
It's important to share.
Lost and not knowing what to do.
Hmm. Yeah. Lost, but I'll say not broken. Doctors make
Yes.
you feel broken, especially when you say you got to the doctor and you're fine until he says, "Oh, you have PCOS," and he treated like you're broken,
Yes. Yeah.
right?
Yeah.
Okay, well, thank you. I mean, we could just talk all night, but I think we get the gist of this story. Oh, you know what?
Yeah.
Actually, the one last thing I want to add in, because other people may contemplate this, whether they're in a same sex relationship or whether they're single or have a partner with no sperm
Yep.
or very low sperm.
Yeah.
The process of finding a sperm donor. I mean, was there any question in terms of using a known donor versus an anonymous donor? Traverse.
Yeah, and I mean, whatever the situation, everyone has their personal preference. We we wanted an unknown donor, and in order to use donor sperm at our clinic, you had to have a session with a social worker, and they strongly, strongly advise against known donors. It just gets complicated. That's all. But I know a lot of people who have used known donors, but it was
Mhm.
important to us. And again, it was just what was important to us, that we wanted it to be viewed as a genetic donation, versus a parental figure or a father that it's not a father or even a parent, right? So
No, not at all.
it was an unknown donor, and a very interesting process because you already have your partner, your spouse, and then you're sitting over a computer scrolling through profiles and feeling like you're picking
Oh, you're cutting out.
appearance. Tell me when I'm back.
Okay, you're back now. So
Okay.
you're looking at the TV screen and or
Well,
monitor.
like scrolling through the profiles, and it's just a very bizarre experience because you're picking someone based on different characteristics, but it's not your spouse. So I don't know. It was a very interesting, and I remember making a comment about a certain aspect of the appearance, and my wife just looking at me like, I didn't know you were so shallow. And I'm like, I'm not shallow, but I'm like, we can afford to be picky. Like, we can
Absolutely.
afford, we're picking profiles and we're spending a lot of money on this. So,
Yes. And this is your future child. So of course.
right. Yeah. So we had
Yeah.
a few giggles about that. But yeah, it's a very surreal process. But yeah, we were very happy with what we picked. And it was just super important for us to, if possible, to have both of our children from the same donor so that they were 50% genetically the same. And
Right.
it worked out. So,
Yeah. Thankfully.
yeah.
Yay. That's
Yeah.
good. Thank you again
Yeah.
for sharing your story.
Thank you,
And
Mary.
hopefully I'll see you one day.
I'm sure I'm sure you will.
Okay.
All right.
Live, live. Okay.
Yeah.
All right. Thanks, guys, for tuning in. And next week, I won't be on a Wednesday. I believe it's on a Friday. And of course, I'm so prepared. I forget to look at what I'm doing next week, but it'll be something good. And so you could scroll down. This is number 123 post. Okay. So you can scroll down and see a lot of posts under here. And you could subscribe to my YouTube channel. Just go to marywong.life. For those of you who are not on Facebook, if you're on Facebook, you can certainly just like the page, Mary Wong RTCMP, and then you'll just get notifications every time we go on. So that's very good. And yeah, if you like this story, please share it, like it. Are you on Facebook, Amy?
I am. Yeah.
Oh, maybe you could share it. Would you share it?
We'll see.
Let's see. See, but this is what I'm talking about. Although people go through this, it's still such a private
It
conversation. A
is.
lot of discomfort, right? Sharing.
Yeah.
So, but I'm not forcing you to do anything.
Okay.
Don't worry. But like for sure, it lands and stays on my feed anyhow. So I hope that's
Yeah,
okay. Because you would agree.
absolutely.
Yeah.
Yeah,
Of course.
absolutely.
And for those of you who are watching the first time, I did write the book Pathways to Pregnancy. So there's actually 15 stories. So one is similar to yours, but not similar. They're all different. But you know what? We all have this commonality, the struggle, right? So check it out. And if you don't want to buy the book initially, you can just go again to marywong.life and you get a free chapter if you sign up. Okay. So I'll see you next week. Thanks so much again, Amy. Take care. All right.
Thanks, Mary. You too.
Bye, everyone. Okay. Bye.
Bye.